Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What are the most common health concerns associated with the intestinal tract?
When we talk about the intestinal tract is kind of a basket term. The intestinal tract goes all the way from the mouth all the way down to the large intestine. So what I'll be talking about is the lower part of the intestinal tract, because that's what colorectal surgeons do. And that's called the colon, the rectum, and then the anus. So it's the very end. It's where the waste product is sort of stored at a time where it's convenient to pass the waste. So the most common concerns that we see in the lower gastrointestinal tract are related to essentially diseases that occur in the large intestine or the colon, and typically those, the most common ones, are cancers. And the other areas are diverticular disease, which is really common, and then inflammatory bowel disease. Inflammatory bowel disease is kind of a catch-all term for inflammation of the large intestine that we really don't know what causes it, but it often causes problems and brings patients to see us in the colorectal surgery area. Then the other area that we deal with is at the very end, or the rectum in the anal area. There's a whole host of problems that occur down there. The term that used to be used was called proctology, and people understand proctology. There's sort of TV shows that kind of made fun of proctologists. But it's an area of the body that actually is very important, and it also has a lot of potential for problems. Fortunately, most of those problems are more of nuisance problems than real severe ones. And so those patients come into you that sort of everybody knows the word hemorrhoids, and so they think about hemorrhoids as that being the problem in that area.
How often do you encounter patients with advanced health risks because they didn't seek out help when needed?
Too many times, especially, patients don't want to come for various reasons. We're talking about an area of the body that may not be something people talk about at cocktail parties, unless you go to the parties that I go to. We talk about those all the time. But they sort of deny those issues that, hey, things aren't working well, and they're concerned. They're concerned that there may be a cancer or something else there that's like, uh-oh, there's nothing that can be done about this. So embarrassment, concern, concern over how someone's going to evaluate that area. I think that's the reason why people kind of wait till diseases may be at a stage where they're harder to deal with or impossible to cure.
What do you tell patients who are experiencing symptoms but too embarrassed to ask for help?
Believe it or not, this area of the body has issues that affect a lot of people. And once you sort of get over that initial embarrassment, I think the vast majority of people that I see are very comfortable about talking about it, because it is a concern that they want to express. And so just, I remember when President Reagan had his colon cancer uncovered, he put out a bulletin saying, embarrassed to death. So it's important to get over that embarrassment, because there's a lot of good things we can do to solve those problems.
What should a patient expect at their office visit?
Well, when they come in for a visit, there's one of 5 of us that are board-certified colorectal surgeons here at UMass, and we all we have a very good relationship where we talk to each other. So what they can expect is if they come to see me or one of my colleagues, they also will get input from my other colleagues if there's an issue that's quite complex. The other thing they can expect is an understanding ear, a compassionate evaluation, because we all do understand that this is an embarrassing topic, and also it can be embarrassing as we examine a patient.
What can be done to prevent health issues?
Eat a good diet, plenty of fresh fruits and vegetables, eat lots of fiber, and exercise and watch your weight. That holds true in the colon. The colon functions the best when it has fresh fruits and vegetables, high fiber, plenty of fluid, and exercise, and watching your weight all tends to sort of, from what we understand, prevent problems in the area of the colon and the rectum. This is an area where the very common problems exist. I think the vast majority of these problems can be solved very simply. And the other, I guess the ending note would be another part of what we do in colorectal surgery is screening for problems like colorectal cancer. And the guidelines for colonoscopy are very clear, and I think that's one of the things you can actually do to prevent problems such as colorectal cancers. Get your colonoscopy.